Although self-medication is a common practice for long, present scale of people buying drugs above the counter to treat their ailments is most worrying. These days, family members, friends, neighbors, and internet browsing have greatly influenced instant suggestions for medicines and solutions to treat self-recognized illnesses and symptoms. This practice is not common to Nigeria alone, but a global phenomenon. According to World Health Organization, the selection and use of medicines by individuals to treat self-recognized illnesses or symptoms is a public health practice referred to as self-medication or self-care. Many know little about drug interactions, adverse effects, dosages, and important factors about medications that only health personnel can provide.
I used to go to small clinics and pharmacy, but if the things permit, actually I used to go to hospital.
Inda na jin ciwon kai da irin kaman banda kudi in akwai naira 20 ko me zan iya saya, ina zuwa ina sayar wajen masu kwando wawa da sauransu.
Go to America. If you have an headache, you won't go to the pharmaceutical store. What do? You go to the physician. He has to measure your BP. He has to know what is the cause of that headache. But in Nigeria, even a little girl go say I'm jade yellow.
To in ciwon ya kai na ciwo, zan je likita duba ni. In kuma bai kai ciwon da zan je likita duba ni wa zan je kemis.
Sauki ake so. To kuma na tsaya na ji so ina samun saukin abin ba sai na je asibiti ba.
Sai mun je wajen doctor tukuna ya rubuta mana sai mu zo mu karba pharmacy.
Some patient may come, I need paracetamol, I need this and that. So those drugs that are not prescriptive drugs, we do sell them as well. But those prescriptive drugs, if you come without doctor's prescription, we don't dispense it.
Borno State Commandant, Nigerian Drug Law Enforcement Agency, NDLEA, Joseph Icha, and consultant obstetrician and gynecologist, State Specialist Hospital MAIDUGURI, Dr. Emmanuel said, taking drugs on one's initiative is hazardous, leading to complications and in some instances, even death.
Those that are medical doctors or that are medical professionals are certified. They have gone through a process of acquiring certificates, understanding and knowledge. So they have the professional competence to know what to give for what kind of ailment. But when you are in the house and you start treating yourself, you know, you could even damage your health. What you can do, in case you even have the challenge, how you can help yourself or how you can help your relative or your son or your child to come out of that problem by coming to us.
Sometimes taking drugs without seeking medical advice, it can even destroy the patient's kidneys, like the common drugs that are being taken in the society, what we call the NSAIDs, the cataflam, ibuprofen, without any medications. Such drugs can destroy somebody's kidney. And in that way, the patient may feel better as if he is having relief from his pains in the body, but not knowing that those drugs are actually destroying the kidneys unknowing to the patient. It is advised that once you have any pains or any ailment, you should see the doctor. People should desist from taking self-medications. Once they have any problem, they should seek medical advice so that they can get proper drugs for their ailment. Sometimes it is simple advice, counseling. They may not even need drugs. Simple counseling may help.
For those who do not know, self-medication often leads to drug abuse, which can cause avoidable mental health conditions, organ damage, and death may follow. A recent research conducted by medical experts has shown that consistent self-medication is injurious to health, thereby causing more harm than good. As such, it is paramount to visit a medical expert for proper diagnosis and medication.